Well, it seems like every night we learn something new about the Omicron variant, and new insight tonight into why scientists and medical experts studying this new variant continue to say, in general, Omicron cases cause less severe disease. So why might that be? Let's go ahead and talk sources first. We talked to Dr. David Priest from Novant Health. He's an infectious disease specialist, and we also read studies from the Centers for Disease Control. Now, Dr. Priest says that Omicron replicates more in the airways rather than in the lungs. And so when a virus gets into the lungs, like, for example, with the Delta variant, it can have really serious complications. However, the downside to Omicron, Dr. Priest says, it's still incredibly contagious.
If you have a variant like Omicron that maybe causes less severe disease, but causes far more cases, just the sheer volume of cases is going to lead to more hospitalization. So we haven't reached the hospitalization number peak we did with Delta, despite we've exceeded the case count with Delta, with Omicron. But a less severe virus that hits way more people is going to result in higher numbers of hospitalizations.
So on that note, let's go ahead and talk about those COVID-19 hospitalizations. This week, North Carolina reported the largest single-day spike in the number of patients with COVID-19. We saw that going from Sunday into Monday, when counts rose by 250 patients. So we can see here, it seems as though the state is on its way back towards its peak hospitalization levels. There we are at this point. We've highlighted, of course, the previous two surges. You could see the first one from last winter and then the second one from late summer of this past year. This dotted line really trending up pretty quickly at this point, but we're not quite there yet. We, of course, will continue to keep an eye on these numbers.